welcome back. We're talking about Lassa fever, especially in the light of the new case that just happened recently. It's time now when you can call in and ask your questions. Maybe something has been bothering you about Lassa fever. Do call in on 0808-054-2233. That's 0808-054-2233. And you can tweet at CTV_Mary A. Now, you were talking about keeping environment clean as a way of discouraging this the transmission of Lassa fever. Any other things that we really need to look into?
Well, for the transmission of Lassa fever, rodent control is very, very important.
By rodent control, I meant to ask you, I mean, rats do repopulate quite fast. How many times do they give birth a year anyway?
Well, the rat you're talking about, the multi-mammate rat, is actually a particularly fertile rat, if you want to use that expression. They really breed a lot. And that's why it's not a very realistic target to say we are going to eliminate the rat population.
But we can reduce them.
We can reduce them, but at least we can keep them away from our own personal space by making our houses and the environments rat-proof. That's one way, by setting rat traps, by constantly fumigating, both individually in our homes and collectively as communities. Well, I wouldn't go into that. I don't know. What I know is that whatever options for rat control that are proven to be effective should be employed.
Because since they multiply, you know, a bit of reduction should help.
Exactly. But the most important thing is don't let them have access to your home and your environment. And then in our homes, the way we store things, our foodstuffs, we should make sure as much as possible that they are rat-proof. In the markets, the way the market people package their foods, they should be encouraged to begin to make those things.
So there's room now for enlightenment of even market women.
Exactly.
It's a very holistic thing you're trying to present now. Everybody needs to be involved.
Exactly. Everybody needs to be involved. But, you know, it has to become a way of life for us.
Second nature.
Yes, it has to be second nature, these things, because we are protecting from Lassa fever, but I always want to say, who knows what else we are protecting? Because if you notice, most of the emerging and re-emerging infectious diseases have a zoonosis. By zoonosis, we mean they usually have an animal a vertebrate reservoir. So we are protecting for this one, but it should become a way of life that we begin to live very clean.
Let's take this call from Felix. Hello, Felix.
Hello, good afternoon.
Good afternoon, Felix. What's your question?
Not a question, but I would like to know what, because for some time now, Lassa fever has been the talk of the town. I don't know. So what I'm suggesting is if the government is taking any measure as regards solving the issue, because we keep on talking about it over and over. It's not the first time I'm listening to this conversation on TV. So is there something the government is doing? Is there a kind of research to
Thank you very
kill
much.
this permanently? So how to know the measure the government is taking as regards this Lassa fever?
Thank you, Felix. Well, as far as you know, what is the government doing?
I do know that the government is working hard on it. We have the National Centers for Disease Control. I think they're on top of it and monitoring. And wherever you've had cases, government has actually gone and deployed staff, and they've done the contact tracing, and a lot of community mobilization has been going on, a lot of collaboration with the World Health Organization and other partners. So that has been going on. But these things they are things that must be addressed. It goes beyond government, really. Government will do its part.
Just as you said,
exactly,
we have to do our part.
Individuals would have to do their part. Communities will have to do their part. And by government, it not necessarily has to be only the federal government alone. The local governments will need to function.
Yes, when you say communities, there was a time people used to go around and actually educate the public in different languages about some of these things. But we don't see that anymore.
Maybe this is the opportunity for those things to come back. They really need to come back. Communities need to begin to understand their own role in all these things, because the truth is that these things are coming, and we need to begin to be proactive about them.
When there was Ebola, even in church, yes, there were lessons about Ebola. Maybe it has to go that far.
But the point now is, how many people are still washing their hands after Ebola? Everybody was washing their hands. But I tell you, hand washing is still very critical. As at today, both for Lassa fever and for every other infectious disease. So these are the things we must begin to take seriously, that some practices must be there, whether we know what we are dealing with or we don't know what we are dealing with. But then the second part of the transmission, I've talked about the first part, which is the primary from the animal, but then you still have the propagation from human beings to human beings through contact with body fluids, blood, urine, body fluids.
Let's quickly take Okey first. Hello, Okey.
Good afternoon.
Good afternoon.
Well, first of all, I appreciate your guest on the erudite expression you have been showing, on the trying to describe and talking about the Lassa fever. But what I wanted to, the comment I want to make is that it is really disheartening that a country of about 170 million people, which Nigeria is, and at our level of development, there are only 2 centers at Irua and the other variology in Lagos that can detect Lassa fever.
Thank you so much. Thank you so much, Okey. In your opinion, how many centers should we have for Lassa fever? I mean, it's being an endemic.
Yeah, I don't have the information, the statistics to answer that question, but I must tell you also
we should
that
have more than 2.
But there's a certain level of lab you need before you can handle Lassa fever.
Does it have to be a basic 4 lab?
Yeah, no, it has to be at least biosafety level 3 and 4.
At least
preferably 4, yes.
Okay.
So you can already see the difficulty with the logistics. And that's why people are pressing for a rapid diagnostic test.
Okay.
If we're able to, research is ongoing.
For now,
yes.
How long does it take to test?
I really don't know, but at least I know it should take more than a day. I really can't tell. Okay. I don't have that information.
But a rapid diagnostic test would significantly shorten that time.
It will significantly shorten that time. So that's what people are pushing for. If we can have research that can help us get something like that, then it will help a lot in shortening the time. And if we're able to shorten the time to diagnosis, then the time to definitive treatment will also
be shorter. But then you were talking about the human-to-human transmission.
The human-to-human transmission. What you notice is that when these cases then come, and usually caregivers at home may then get infected or get in contact with these body fluids, then it comes to hospital or health facilities. And what we call amplification of these things happen in health facilities.
Because the person at home is talking and touching other people.
And then the person comes to the health facility, health workers are then exposed. And that is where I want us to really look at.
Concentrate.
Is
there a higher level of safety for health workers? They seem to be at risk, more at risk.
When you say higher level of safety,
not just washing of hands.
We must not discountenance washing of hands.
Yes, but that's for everybody, right?
And that is why I say that we must become organized about these things. We must become systematic. There are what we call standard precautions. And by standard precautions, we mean these are the standards that must be kept for every activity you do in a health facility, whether you know what that patient has or not.
Could you give us an example of what you're hinting at?
I'm coming there. Then there's the transmission-based precautions you also need to take when you then have an idea of what you're talking about. But as a nation, we must come together and agree that infection prevention and control is important, because it's a very important thing in this battle we are facing in emerging and re-emerging infectious diseases. We can't be losing our health workers anyhow. So the country must come and have guidelines for infection prevention and control as a national guideline, so that every health facility can then take it and use it as a basis for development of their own standard operating procedures.
And that's for the whole country.
Every nation must have its own standard.
Okay.
And this must be evidence-based.
We'll come back to that, but we need to take a short break. Okay. Please stay with us. We still have more for you.